Hello, my name is Chloe, and in this video I'll be showing 2 sagittal and 2 frontal strengthening exercises, along with a stretch for the Glute Max and Glute Med. The Gluteus Maximus is the prime mover of hip extension when the joint angle of knee flexion is 90 degrees or less, thus making the back squat a well-suited sagittal movement for the Glute Max if you are hitting 90 degrees in knee flexion. The more knee flexion, the more eccentrically stretched the glute will be. In a reverse lunge, the primary joint action is hip extension, if the angle of knee flexion reaches 90 degrees. The prime mover in this case would also be the Gluteus Maximus. The more hip flexion that is produced, the more eccentrically stretched the glute will be for a larger contraction during the concentric phase. Hip abduction occurs within the frontal plane. The Gluteus Medius is mainly responsible for hip abduction. As you abduct the leg from the medial line of the body, the Gluteus Medius is providing stability and the contraction you need to return to a neutral position. It is important to stay aware of knee varus and knee valgus. The knee should remain neutral. The lateral squat is also a frontal plane movement which will target the Gluteus Medius due to hip abduction. It is important to continuously abduct the hip and return to neutral as soon as possible to avoid completing a normal back squat. Shown in this video is a stretch for the Gluteus Maximus. As long as the joint angle of the knee is less than 90 degrees and within the sagittal plane, the Glute Max will be stretched. Clients with a larger range of motion may need to elevate their foot onto a higher surface in order to maximize the stretch. Because the Gluteus Medius is responsible for hip abduction, the leg must be adducted across the body for the muscle to be stretched. In this position, I have allowed for a stretch between the insertion points of the Glute Med through hip adduction.